Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Uh, and the role that mental health plays with all of the stuff that goes on with athletics, uh, with amateur as well as professional athletics, as we see many instances of depression everywhere you go. And I think a lot of it is intensified by the pandemic, as we talked about it before. And one of the things to keep in mind is that it doesn't mention it here, but it's good. It says boost your mood, but it's good for your mental health as well. Exercise is good for your mental health. And we've talked about how exercise affects the brain and the circulation, etc. So,
Well, I think that's been going on for a long time, but I think with COVID, it's now being addressed. If we're finally looking at it, I think people may have thought it was a stigma or something like that. It was something bad to hide. And now with this, some of the athletes have come out, with their feelings, and I think it's done a great service to everybody, really.
yeah, because that's it's one thing to exercise for your own good. It's another thing to make it your profession or your claim to fame. That makes it different. Yeah. Okay. This is a slide I wanted you to put in because a lot of people talk about how antioxidants help you. And this article suggests that they're overrated. And it talks about all of the antioxidant supplements. And you have more than 100,000 people who have been tested to try to see how it really helps or doesn't help. And you see, it did not reduce the risk for most of the people who they tested. And they talked about a lot of different areas that they tested, with women being the focus of many studies, and looking at how it would decrease cardiovascular disease, hypertension, and arteriosclerosis, and so forth. And bottom line was that there was little evidence that anything happened differently as a consequence of the antioxidants. That was one study. And then there's the physician study where they looked at physicians with multivitamins, which we've talked about before. They looked at MI, myocardial infarction, strokes, and hypertension. And here again, they looked at vitamin E and vitamin C, and they couldn't find any evidence that it decreased any of those. So, and then there's another study that looked at prevention of prostate cancer with vitamin E, and that also failed to decrease the risk of cancer. So I guess the conclusion was that couldn't demonstrate that antioxidant did much. Any other thoughts about that?
Well, both my parents were, took a lot of Shackley supplements, and it didn't do them any good, other than they did lose a lot of weight from their wallets.
Anybody think differently? The evidence does not support it, but that doesn't stop people from using antioxidants.
Because what else do people have to go by when they tell you on television and every place that you should have this to have a better life? So you believe it. So it's an advertisement, and I guess do doctors buy into this also, Dr. Callender, when they are
I
talking
think,
to their patients?
well, I don't know anybody who recommends antioxidants. I think much of it is advertisement, and I don't know anybody who's opposed to it, but I don't know anybody who touts antioxidants.
But don't doctors talk about getting multiple vitamins? And we've had that also.
I don't know any doctors who talk about that. I think if you have a vitamin deficiency, that you need to take vitamins. The evidence for multivitamins is about as weak as the evidence for antioxidants. So, but if you have a deficiency, then of course you need to take vitamins. So anyway, it's a subject that's been discussed much. Now this is an article that talks about whatever doctor should watch for, but whatever doctors should watch for, your patients should watch for as well. Because these are the so-called silent killers, of course. I think the most silent one is hypertension and kidney disease. But pancreatic cancer is a silent killer because we don't have any treatment for it. 5-year survival is less than 10%. So it's the deadliest solid organ cancer we have. We've gotten treatments for many things, but not much for pancreatic cancer. And often it just presents itself as either no signs or symptoms or back pain. And it takes studies to identify it as a source of problem.
Are there known causes for pancreatic cancer?
Say again?
Are there any known causes for pancreatic cancer?
We don't know. No, we don't really, haven't been able to identify the causes for pancreatic cancer.
My mother-in-law died of pancreatic cancer, and I always thought it was the doctor's fault for not diagnosing it. Now you're telling me it's hard to diagnose, right? Because
hard to diagnose, and when you diagnose it, very few people are able to be effectively treated without surgical intervention. So if you get an early pancreatic cancer diagnosis, and you can have surgery, and they can take it out, but still the 5-year survival is still less than 10%.
Dr. Callender, do they have cancer? I mean, pancreatic not implants, but transplants?
Yes, but not for but pancreas transplants are really for diabetics. For cancer, you have to take it out, and if you take out the whole pancreas, you have to be sure that there's nothing left behind before you would do a pancreatic transplant.
And then if you take it out, don't you get diabetes?
Well, it depends. Depends how much you leave behind. If you take it out completely, yes, you would have diabetes. And that's one of the complications of a pancreatectomy, is that you would of necessity have diabetes because you don't have a source of insulin.
Are people that suffer from pancreatic cancer, are they diabetic before the cancer is diagnosed?
Diabetes is not commonly associated with the diagnosis of pancreatic cancer. Is that what you're asking?
Yes.
Yeah. There's not a correlation.
So, Dr. Callender, would you, is there any way to, any kind of symptoms to look for with that? I had one of my coworkers' wife's wife had it, and she was gone in 2 months. I mean, period. It was unbelievably quick death. Are there any symptoms to look for, or?
Back pain is one of the common symptoms. If you suddenly get jaundice, that's a symptom. Pain often is the earliest symptom, but the problem is that most of the symptoms occur late. And so the way of diagnosis is by x-rays. And MRI and CAT scans can identify the pancreas and identify if there's a tumor in the pancreas.
Dr. Callender, do you have any ideas of why Leslie, my daughter, was put on the pancreatic transplant list and then subsequently was taken off?
Only she would probably know, because they sent me a letter when they put her on, but I got no information about her being taken off. So I'll have to ask her and find out what they told her.
And let
She
me
said
ask,
insurance was the ones that determined that she didn't need it.
What's that?
The insurance company, and they wouldn't pay for it.
Oh, that's different. So if the insurance company wouldn't pay for it, then I guess that means she has to find another. And usually they would give you the details in terms of where they would pay for the transplant. And I think Leslie would know the details, or the Georgetown would know the details in terms of why they wouldn't pay for it.
but Dr. Callender, for me, that doesn't answer the question. If you're on the list, but you're taken off the list, I mean, there are other ways you can go to GoFundMe or something like that. You can do that if the insurance won't cover you, but because the insurance won't cover you is not a good enough reason to take you off the list completely.
Oh, yes, it is. Yes, it is, because if the hospital's not going to get paid for the transplant, they're not going to do it.
Well,
So you would have to provide ways in which you can provide the funding. In that situation, they would put you back on. If that
okay, that answers the question for me. In other words, if you wanted to set up a GoFundMe page and solicit donations, then that would be a good enough reason to keep you on the list.
No, you'd have to raise the funds.
You got to raise the funds first.
Right. And I think pancreas transplant, I forget how much pancreas transplant would cost. It's I've forgotten exactly how much it would cost, but I know it's probably around a couple of $100,000. But yeah, if it's insurance, then it's not medical. Then that's the tragedy of the insurance you have. Sometimes the insurance will not cover at one center, but will cover at another center. So the details of the reason why the insurance was why it was decided they wouldn't pay for it, it becomes important. So you need to talk with the insurance coverer and find out, are there centers for which they will pay for transplant or not? Because I don't know what kind of insurance she has.
Yeah, well, that answers the question for me. It's not the insurance company that took her off the list. It was the hospital.
No, but wait a minute. It's the same thing. If you don't have coverage, if you don't have, it is the insurance. If the insurance doesn't pay for it, then you don't have any coverage. So don't say it's not the insurance. It is.
Well, what I meant by not the insurance, the actual entity that takes you off the list is the hospital that puts you on the list.
That's true, but it is the fact that you don't have any way of paying for your transplant.
Is the reason why the hospital took you off the list.
Right, but that's based upon the insurance company saying they wouldn't pay for the transplant.
Got it. I got it.
Yeah, so it's a double whammy. So the question is, why wouldn't the insurance company pay for it? And if they wouldn't pay for it there, would they pay for it anywhere? Or do they just not pay for pancreas transplant at all? I don't know. That's a question that you'd have to ask the insurance company.
Yeah, well, I did find out that they do, this insurance company, they do cover pancreatic transplants. It's just in her particular case, they said no.
Well, you need to know why. Is it because of the transplant center, or is it because of what about her is different that made it not cover? Why is she not covered then? That becomes an issue. That you need to find out why. Why did the insurance company elected not to cover her? Because that becomes important. Because you say if they cover it, well, then what circumstance do they cover it, and why is she not coverable? Those are the questions that you need to ask the insurance company. And is it related to where she's being transplanted? Because sometimes insurance companies only pay for transplant at certain centers. And those are the answers you need to get. Yeah. Now, this is silent heart attacks occur, particularly with diabetics, but they occur to a lot of people. They just don't know about it. They don't have any symptoms, and they just have sometimes shortness of breath or fatigue, and that's all that they get. Most people have pain, but not everybody. So silent heart attacks is something that I remember the first transplant I did. He died 17 years later, but he had a heart attack after the transplant, a silent MI. It didn't affect his survival, but silent heart attacks are known to occur. Next is colorectal cancer, which is why we recommend colonoscopy, because you want to get it before it develops. So you want to get it when you have the polyps that are the commonest cause of the cancer. And so you have colonoscopy, find polyps, take out the polyps, which are the commonest cause of the cancer. And that's one of the ways that we try to address this cancer, which often can be late in developing signs and symptoms as well. Then, of course, next is hypertension, which is a well-known silent killer, because the time you get symptoms is when the hypertension is already affected your body parts, whether it's your heart, your kidneys, or your brain. So that getting your blood pressure checked at least once or twice a year, and having a blood pressure apparatus at home so you can check it yourself become important. And once you find you have the disease, it's pretty clear now that medications or ways of dealing with hypertension, including exercise and nutrition, may often avoid the need for pharmacotherapy. So that the first thing you do if you have high blood pressure is you exercise, you lose weight, and if that doesn't work, then they put you on medications. But exercise and nutrition are probably the initial way to address hypertension. So a third of Americans have high blood pressure, but many of them are not aware of it. What is the age at which you should start getting your young people checked for hypertension? Anybody have any idea? What age did you start looking for it?
12.
Yes, the age of 12. Sounds pretty young, but that's the age of 12.
Well, a lot of kids start smoking at that age, 11, 12 years old.
Well, it's a practice that parents should condemn, but what can you say?
But
But,
I
yeah.
think it's the sedentary children not moving. You know, they've taken recess out of schools, children being latchkey kids, and they're not moving and playing as much as children of 2 or 3 or 4 decades ago. So children just looking at television and playing on their phones and etc. So, right, and playing games, video games. They're
Yeah,
not
parent-
moving, they're not exercising, so and they're gaining weight.
and the parents should prevent that from happening
They're exercising their thumbs.
because the because the schools have not fulfilled their responsibility anymore. But that doesn't mean the parents should.
Yeah, I had my grandchildren over and something they know now, but the first couple of times I said, go outside and play. That was like a foreign statement to them. What do you mean go outside and play? They would they'd rather stay in and play on their phone and video games, and you would have to take and say, well, what we gonna play outside? Their creativity and all of that has dissipated.
Wow.
Children no longer have that. But
That's
if they go outside enough, they'll find out there's sticks or something to play. You don't have to have organized games for children.
Yeah, and of course, depending on where you live, you go outside, you may get shot. But anyway, it's yeah. So it's important that parents exercise their responsibility, whether they find ways to get them to exercise in the house or outside of the house. Now, this is something that is well known now, that heart disease affects men and women differently. And sometimes it's symptomatic, sometimes it's not. And sometimes it's demonstrated by pain in the neck, pain in the chest, pain in the shoulder, pain in the arm, or shortness of breath, easy fatigability. Those are things. Of course, the risk factors, heart disease, nicotine, as you mentioned already, diabetes, high cholesterol, high blood pressure, obesity, and lack of physical activity. And then any kind of pain in the neck or chest or shoulder can be symptoms of heart disease. Many of the heart disease studies early on involved only men, which was unfortunate. And so the signs and symptoms of women were not really particularly emphasized. And women were not treated as often for disease as men were. And as a consequence, it took a long time before people realized that women present sometimes very differently than men. This then becomes important because one size does not fit all. So any, as it says here, any symptom between the navel and the nose that comes on with exertion, it goes away with rest, needs to be considered as a possible evidence of a heart attack. Because there's so many different ways that it may present.
And Dr. Callender, the difference between deaths of heart attack between men and women in this country is interesting too, because I think we've learned on this group session that far as deaths, heart attack is higher on the list for women than men.
Yeah. And one of them is because I think women are not treated the same way as men are. They are less likely to be recommended to have open heart surgery or coronary artery stents than men. And so it's sad to say, but there's discrimination, gender discrimination, which means that women have to be more sensitive to any symptoms that they have, and tell their physician about it, because it presents so differently in women than it does in men.
I like that insert knowledge is powerful, is power. Getting, materials out for them to read. Read about in the Washington Post yesterday, there was a judge and she was taking on the Trump people that were in the riot. And it wasn't because, but she educated them, told them to read books on history and etc. And some of them actually changed because they're thirst for knowledge and they did not know the structure of America or the history or the laws. So of course, believed what was taught to them. But she only persuaded them by giving them books to read so they could be educated, and that's knowledge is power. So like women and men, if they know about what to look for in these symptoms and everything, and be an advocate for yourself, because knowledge is power.
So true. So true. Okay. Well, I don't know. It's interesting. They talk about fungus spreading cities, and one of the problems is that some of the funguses they have now, especially this one, is not very treatable. So what it emphasizes the importance of cleanliness and trying to prevent infection of any kind. Because now we have some funguses, as is talked about here, that often are not easy to treat. And this then is, to me, a call for us to be, when they used to say cleanliness is next to godliness. So preventing infection is really what is the essence of this. Yeah. Because the problem with this is that they don't really have a good treatment for it.
Yeah, Doc, I jumped right on this because they said it was in DC that they noticed it. So, whoa, let's be careful.
Yeah, well, the treatment, the problem is that it's resistant. So the best treatment is prevention, because they don't have a good treatment for it. And this is another issue that people coming from out of the country have brought in this virus. And it's scary because we haven't been used to treating it. So people who come from other countries, and I think this is one of the problem is when you go to another country, they give you tests to identify whether or not you have this, and they give you vaccinations. But when somebody comes from another country who has not or has this kind of disease, then it can be contagious. And now, what does this do to people who come from Africa? Does this make them suspect? I don't know. I guess so. Now, this is an article that becomes important because I just had somebody call me because they had COVID, and their parent is 100 years old. They were afraid that they would give their parent COVID. And so in this kind of situation, this is where the COVID-19 antibody can be used to prevent COVID. And so this antibody can be given to those people. For example, somebody's on steroids and is exposed to COVID. This is the kind of person for whom these kinds of antibody treatments can be effective. So it's good to know that there is a treatment for those people who have been exposed to COVID that can prevent them from getting COVID. So it's good to know that this kind of treatment is available. Many people are not aware of it, and therefore, when they get exposed, they do nothing except quarantine them. But if you're high risk, you should get the antibody treatment.
It's pretty expensive though, isn't it, Doc?
Yes. But it's the only treatment we know that works. This is important information that people who are fully immunized can spread the Delta variant as well as unvaccinated people. The problem is, situation is that the people who are unvaccinated are likely to get severe disease and may die, whereas the people who are vaccinated may often be asymptomatic, but they can still spread. So this is the reason why they went back to recommending masks. Kind of surprising, and one of the things that it points out is that we don't know everything about COVID, and we're learning more and more every day. And so we have to be welcome to new information that helps us to understand more and more about COVID.
At the same time, are we learning more and more about viruses in general?
We're learning more and more about COVID. I don't think one size does not fit all. And this is another controversial issue because it's clear to me that there's a certain subsection of patients who need vaccine boosters. And those are people who are immunosuppressed. And certain countries, for example, UK has decided that all transplant patients or immunosuppressed patients should get a booster dose. So that everybody does not need to have booster shots, but those people who are immunosuppressed do. And I think World Health Organization is trying to emphasize getting everybody vaccinated, which I think is very important. But it does not change the situation that immunosuppressed patients may need to get a booster shot. So everybody doesn't need a booster shot, but immunosuppressed patients may need a booster shot.
Dr. Callender, what about the elderly? Do you think there's an argument to support 65 and up to get the booster shot?
Not yet, no.
Not yet. Okay.
There's no evidence that that's the case. Now, I think this Delta variant caused us to remask again. I think that's the change. And the change is suggested because that beats the lockdown, because that's the next thing that would come if you didn't have the mask. Now, of course, the best way is to have 100% vaccination, but we don't have that. We've made it to 70%, but we still got many people who do not wish to be vaccinated. What's next? What else can you do? We've tried money, we've tried all kinds of things, and still people, significant number of people, I think only 70% of the staff at the hospital have been vaccinated, 95% of the doctors, but only 70% of the staff have been vaccinated. So, and with this variant, which is 1,000 times more contagious than the original virus, it becomes important because it spreads much more rapidly.
Do you know if the mode of spread is any different? Is it still aerosol?
Yeah, the mode is much more aggressive and easily spread by oral as well as even by touching. So that unlike the original one, which was primarily by oral transmission, this is hyper transmissible. But the only truism is that the more people that get vaccinated, the better off we are, because those unvaccinated become the source of more infections and more variants.
So, Dr. Callender, did they find that before the COVID 1.0 that people had various symptoms? Like my brother and my two nieces, they got it back in March 2020. But and my brother distinctly remembers that he lost his sense of taste and smell and so on. Are there any specific symptoms for the Delta variant that people are getting?
Yeah, they are, but they are different from the traditional COVID, because they can just be go straight to pneumonia as an early symptom. You can have diarrhea, and so the Delta variant may or may not be associated with high fever and the like. So that's why the Delta variant is much more problematic, because it not only goes to the respiratory tract, but goes right down to the lungs. And so the earliest sign may be shortness of breath. And that's why the concern about the mortality rate is not as high as for COVID, the original COVID variety, but the transmissibility is 1,000 times more often. Also, keep in mind that many viruses are capable of causing you to lose taste and smell. It's not only the COVID virus, but the influenza virus will do the same things. So viruses are known to do that. So the loss of taste and smell doesn't mean necessarily it's COVID. It means you had a virus, but it may not have been COVID.
Oh, okay.
The way to test that would be to see if you have antibodies to COVID.
Okay.
Then the next one that's coming is Lambda, which is not as affected by the vaccine. How effective, we don't know. So it hasn't come in the United States yet, but it may be coming. It's in Peru, I think, is where the first identified it. And whether it's going to be everywhere else in the world, we shall see. And how effective the vaccine against it has not yet been clarified.
Doc, this article says something worse than both of those is coming.
Oh, my goodness.
Yeah, well, maybe, but who knows? Yeah.
The
Well, one
andro-
thing they said about the Delta variant is that it's supposed to not be as long lasting as the original virus, because in India and in UK it didn't last as long. But one of the things about it was associated with less mortality. Most of the studies indicate, but it's much more contagious, but not quite as lethal as the original variant.
So have they found out if the, Delta people get long haul Delta?
We don't know yet because because it hasn't been around long enough for us to tell. That long haul of COVID, we'll have to take time because this is new, so we don't know.
Mm. Hmm.
So we will just have to wait it out and see. We will know soon. Meanwhile, we can fear the worst, but we don't really know. We don't have a lot of evidence. So time will tell.
My goodness. Yeah, I've gotten my Moderna, and what I heard was that people on immunosuppressants, it might be effective 45%. So if you get the booster, how much of the percentage goes up that it's
It
going to be?
goes up to about 90%.
Oh, really?
70 to 90%.
Oh, okay.
So that's why they're suggesting. There's studies that were done at Hopkins and at in New York that indicated that it went up from 45% to 70 to 90% with the booster shot.
Okay.
Is the vaccine as a booster any different than the initial 2 doses?
No,
Okay, so if someone wanted to get their own booster, they could just go to a CVS and say, I haven't been vaccinated, and then get a booster.
yeah, you could do that.
They are working on an updated version of the Pfizer. I'm not sure about Moderna, but they are working on a more powerful version of the Pfizer vaccine.
Well, all you need is a booster. So it wouldn't matter whether you had Pfizer or Moderna for a booster shot, because evidence suggests that whether you got one or the other, a booster shot would be effective.
Does that also work with Johnson and Johnson?
We don't know
Booster?
about Johnson and Johnson. There isn't data on Johnson and Johnson, so I don't know.
Do you know why they didn't approve AstraZeneca here in the US?
Yeah, they had some. I guess they were not satisfied that it was as effective as the others, and they also had some concerns about some side effects. So they asked them to repeat the studies and come back again. But it is in some European countries. It is still used.
So are they working on a pill form, like an anti-COVID viral pill form now?
They are working on that. I don't know where they are in that process, though. But they are working on that.
This shows even while these deaths are going up exponentially, people are out there
Spreading.
protesting against vaccinations. It's insane. What the heck is going on here? Look at that.
Yeah. What can you say?
I don't understand that. You know?
Well, people are people, so. Well, the problem is that the more unvaccinated, the more likely to have variants. And so.
I call for this number.
Doc, what is shocking to me, remember, I think it was a month ago when Delta was when it first showed up in China and they shut down that one county. Somebody came back from India with it and they went to a backyard barbecue or something like that. And everybody at the barbecue got it. And they, you know, from that point to now, it's spread over the whole world. It's, you know, that's very evidence, a lot of evidence about the strength of this. It's, you know, it's like smallpox. Did they say, oh, chicken pox?
Yeah.
Spread like that.
Yeah. Yeah.
So, yeah, I'm going to be wearing my mask indoors. That's for sure. Absolutely.
You and I both.
I wear too.
Yeah.
Didn't Delta variant come from India?
Yes.
That's where it was first identified. And this lambda is from Peru.
You know, what some people don't realize, I think most people are becoming aware that viruses are genetic machines, and they are constantly evolving, constantly mutating. And the more copies, the more chance for genetic mutation, and therefore there's a chance that they will have an advantage over their victims, you know, and every different kind of way that you can think of an advantage could arise, they are going to come up with because of the billions of copies of the virus in one person. There's billions of viruses, and therefore the heightened degree of mutation and possibility that's going to get worse and worse and worse.
Well, you know, one thing that's clear, there's nothing new under the sun. So this is the same thing that happened with the Spanish flu 100 years ago. So it's not new.
John Buchanan, what you just said makes viruses no different than human beings.
Well, diversity is what keeps us going, and that's what keeps the virus going.
Yeah, there's no difference. I don't think the way he explained it, you know, they keep mutating, they keep multiplying, and they take advantage of their victims.
They
So do
must
we.
be smart.
So do we. That's why we need to value our diversity, because that's what keeps us going.
Looking back 100 years ago at the Spanish flu, they eventually reached herd immunity and the virus petered out, although it killed
Right.
50 million people.
That's right.
Or 50 million people with it, or whatever the number was. So
yeah, 55 million. Yeah.
So eventually, you know, this virus and all of its variants peter out, but they're just a human price to pay.
Right, a huge price. Yeah.
Didn't they get it and then it went away for about a year or went less and then came back again with World War I?
Well, 2 years. It was 2 years.
Oh, two.
1918 and 1919.
Okay.
Yeah. Just like this one, it's 2000. We got to, it started in 2020, and it's probably with us until 2022, probably.
I think it was around in November, December 2019.
It was.
Well, that's when it started, but it wasn't evident in the world until 2020. You're right. It started in November, December, but we didn't get it until late December and early January. When in doubt, wear a mask. Yeah.
Mhm.
And,
Good advice.
that's the safest advice. Although you don't see it everywhere.
I keep spray with me. Anybody gets up, walks up on me, I just pull it out, start spraying. I'm like, back on. Hey, back on.
Yeah, the most effective spray is going to be bear spray. That'll keep people away.
And park behind me in the shopping line so that they can't walk up on me and start putting things on. Nope.
Look at this figure. This is kind of scary. 97 people entering hospitals for COVID are not unvaccinated, and the 99.5% of all deaths among unvaccinated people. Scary, isn't it?
Wow.
And you'd think that the anti-vax people would face up to the numbers. They talk about, I mean, now you have over 200 million Americans who are vaccinated. So you can't say you don't have enough experience. So that argument is kind of thrown out of the window. So the question is, what are the anti-vaccination people saying now?
Well, it's the power of social media. If the only information you're getting is saying that this vaccine is too new, it can't be trusted, the side effects will kill you. If that's all they're getting from social media, it's like they can't wake up and smell the coffee.
Sad, 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 sad. Why is Florida so backward though?
Because they
That's the
got some
question.
stupid people in charge down there. Sorry. DeSantis, he's an idiot. Sorry about that.
They have a lot of beaches down there, and a lot of people take their spring break down there. And,
Yeah, that's true.
and people have summer homes down there.
John,
Wow.
you can't call people beaches anymore. That's not political.
Oh,
Do they wear masks on the beaches?
Nope.
no.
I didn't think so.
I was at a baseball game day before yesterday, Tuesday, and nobody had a mask on in their seats.
Ooh.
They didn't require masks unless you were indoors, like in the bathroom or in a store.
Did they
They must-
ask about vaccination?
No.
Wow. Yeah.
Now, up on Martha's Vineyard, we went to a lecture with Michael, I forget his name now, and the preacher. And so you had to show your vaccination card to get in.
Oh, really?
And everybody was masked as well. So
Oh,
we
okay.
all felt,
They took it seriously.
oh yeah, very seriously.
I think if businesses and industry take it serious and know that they're going to be hurt financially, they will put a mandate to get the vaccination and wear masks so their business and economy can go on.
Yeah, we just got a indication from the president of the university that all faculty and staff will be required to get the vaccination by a certain date. And if they do not get it, they will be terminated.
The lecture I was speaking of was that was Michael Eric Dyson, and the co-speaker was the woman that we just talked about, newly installed at at Howard. I forget her name right now, but she won the award. Was it Pulitzer Prize?
Oh, the author?
The author. The
Yeah.
author. Right.
When they refused to let her do her thing in their university.
Yeah, to give her tenure.
Yeah.
Yeah, she was brilliant. She is awesome. And Michael Eric Dyson is awesome also, of course.
I think I remember her name. Wasn't her name Georgia Dunstan?
No. This is the newly installed woman at Howard University.
Yeah.
1619 lady, yeah.
Yes, 1619.
Mhm.
It was awesome.
Well, it's clear that probably all hospitals will also be requiring their staff to be vaccinated as well, with a date certain, giving people time to get the first and second shots.
Dr. Callender, what religious group or denomination or whatever says that you cannot get vaccinated?
I'm not aware of that information.
Well, I keep hearing people saying for religious purposes, and I know it's not Baptist, but I was trying to figure out what religious organization, Christianity, Buddhism, whoever is against vaccinations, period.
Yeah, I don't know.
Probably Christ scientists.
So
Christian
they
Science
can't get vaccinated at all for anything?
or transfusions, I don't think.
Yeah.
Okay.
Speaking of transfusions, Dr. Callender, Vera Bullock joined us, and she had a burning question about transfusion. Vera, can you ask your question?
Yeah, can you hear me?
Yes, I can
Yes.
hear you.
My question was, if a person has several, have any studies been done on people that receive several transfusions as to how it would affect their livelihood or their behavior, the recipient of the transfusions? Have any studies been done? Blood transfusions that they received?
Have any studies been done on whether blood transfusions affect what?
Long-term effects.
There's no study that I know of that has demonstrated any impact of transfusions on long-term effect.
I know sometimes, I know sometimes, and I've heard in the past where a person might get sick because the transfusion the blood was not good. And it leads to diseases. But I don't know if any studies have been done on it. So that was my question about
The
it.
studies have been done, but I
Has
don't know of any
anything-
studies that demonstrate a negative impact. Now, there have been studies that shown that people who have multiple transfusions are more likely to get infections. So that study has been done. But in
I know
terms of,
because I read something.
yeah,
But nothing long term.
nothing that I know of that has demonstrated an impact, except that the more transfusions you get, the more likely you are to be exposed to infection. That's the only study I know that has demonstrated a
Are the
negative.
infections deadly?
All that I know is that you're more likely to get an infection. They didn't characterize the infection.
Okay.
I've been a blood donor for a long time, 18 years or more, maybe even 20 years. And before they even store the blood, they test it. There's the screening is very rigorous, and every sample of blood is tested for transmissible diseases. So
Back to the question of religions that prohibit vaccination. I just Googled an article and I came up with a history of vaccines from the College of Physicians of Philadelphia.
Thank you.
And it says that Islam is the only religion in the world that has come into friction with vaccine recommendations. Muslim religious authorities have declared vaccines to be unacceptable since, according to them, vaccines contain pork-derived products. In Islam, consuming pork is forbidden. And in of the major religions practiced in the United States, only the Church of Christ scientists, whose adherents are known as Christian scientists, are the two, well, along with Dutch Reformed, two religious groups that openly discourage vaccination.
So Islam and the Christian Scientists, huh?
Yes.
Okay.
Back to the discussion about blood transfusion and infections and whether some are deadly or not. Well, the point is that infections in general can lead to death if they are not taken care of.
Thank
Okay.
you.
Okay, well, that's good to know about the two religions. Isn't that interesting how they how DeSantis has taken his position strongly. And I don't know why they try to involve Fauci in it. I mean, if they decide they want to do that, don't try to put it on Fauci. That's their.
He's had hundreds of death threats as a result of this. He's been being demonized.
These people are the first ones in line to go to the hospital if something happens.
Right.
It's ridiculous. I was wondering if does the COVID go into the blood? So are they testing? I don't know how it works, but if someone gives a transfusion and they've had COVID, is it in the blood?
Well, usually you have to be negative before you become a donor.
Oh, okay.
So if you're positive, you couldn't be a donor. That's one thing. They have rigorous testing of the donors. As a matter of fact, they won't even let men who have sex with men be donors.
Oh, I thought that changed. Didn't that
No,
change?
has not changed.
Not at the NIH.
Has not changed yet. Yeah.
Well, there's ways around that, though. Did they think about? I mean,
Well, right now they do not accept men who have sex with men as donors.
Oh.
The question
Well,
back,
they
why people
also don't accept blood from people who have tattoos.
Okay. All right. I don't know about
Because
that.
I was doing a blood drive at my church for several years with the Red Cross, and if you have tattoos, they don't let you donate blood.
Okay. All right. Yeah, they're very particular, which is good.
Yeah, I've had a couple of transfusions and my outcome was I'm still here. So I'm like, okay, good.
Going back to Florida, why they're in there, there's a phenomenon that's going across the United States. I'm not saying that they're cult, but it's their line of thinking of going along with Trump. And he did say something negative about Pfizer. Anything he says negative about, even though he goes and gets a vaccine, people, I don't know if they have a cult or how their mind is made up, but they believe still he has a power over their mind and their being, and they believe so much that anything he says.
Yeah.
So since Trump said that, we got so much, it's a disease in America. We've never had it before, where people's mindset and they're following a leader. and I don't know if it's cultism or what it's called. So it's Trumpism, but what he says impacts their very soul and being.
Yeah, but then he snuck out and got his vaccination too, didn't he?
It doesn't matter. When he made that one negative statement about Fauci, and they go on there, even though he got his, that still didn't persuade them. And he said, don't wear a mask one time. And that has controlled people. And even if he put it on for a second, that doesn't matter to them.
Okay.
I look at it
let's-
as mindset from 1943, 44, 45.
Okay, that mindset of the 40s is now in the 21st century.
Mhm.
Back,
Okay, well, let's move beyond Trump.
back, back
Thank you.
Google says that if you got that there's either a 3 or 6 month waiting period before you can donate blood.
Say what? I didn't hear that.
Google says if you've gotten a tattoo, there's either a 3 or 6 month waiting period before you can donate blood.
I see. Okay.
You can donate if you have a tattoo, but you have to wait.
Right. You know, the difference is like, did you go to a sterile tattoo facility? If you went to a sterile place, it's 3 months. If your cellmate in jail did the tattoo, you got to wait 6 months. And then they're still arguing about if you've had a tattoo, can you go to heaven? That's a big argument on Google.
Well, we didn't know who or where they went to get it, so I agreed with the Red Cross. Tattoos,
That makes sense.
no blood.
Yeah, because you don't have any way of checking, so they
They
did
didn't bring any proof.
the safest thing. They did the safest thing. Yeah. Well, this is the article that talks about that in spite of the Delta infection at the tip of Cape Cod, which people go to vacation, that we talked about this earlier, how that is effective against Delta. But that also, you remember, it still was still in the cavities of vaccinated people. So the fact that they could still spread it, whether they got the infection or not, was an important aspect, which is why masks are so important. But one thing it did demonstrate is that the vaccine is effective against the Delta variant. Well, it's going to be interesting to see how things play out over the next couple of months, because we have the fall coming up, which is time for the flu season again. So we'll be talking about vaccinations for the flu, which people usually start doing the end of September or the beginning of October.
Well,
Wasn't there
since
been
I'm fully
flu
vaccinated, do
here?
I need a flu shot this year?
What's that?
Since I'm fully vaccinated for COVID, do I need a flu shot this year?
Yes. Yes, you do.
Didn't the flu go down last year because people were
Markedly, yeah, because we were behaving sensibly. We were isolating and socially distancing and being clean. So yes, the flu rate was lower than it has been in a decade.
And washing also.
Yeah, but you still need to be vaccinated.
Some people before COVID came in weren't washing their hands at all.
Right. Right. Yeah, it's changed life for most of us. Yeah. Well, better late than never. We got to 70%. The question is that going to give us herd immunity? And apparently not, since we get all this Delta deaths and infections. So,
Well, I'm mentioning this because I got my buddy who's who hasn't gotten the shingles vaccination. He's on dialysis and he just got shingles. And so I just searched, has shingles increased since COVID? And let's see, if you have COVID, it says that your chances of getting shingles are greatly increased. So a plug for getting a shingles vaccination if you haven't already had one, because if you've had chicken pox in the past, you're a candidate for shingles. And as a 2 times shingles sufferer, I can tell you that this is something you don't want. It's horrible. So get your shingles vaccination.
thank you very much. Very good. Well, this just shows, over 4 million people dead from COVID, and more than 600,000 Americans dead. And people still don't want to be vaccinated.
200 million cases.
Yeah. $200 million cases, 4 million dead. And still.
What caused me to get the vaccination was I'd rather dance with the devil I know than the one I don't. And so I knew in my situation, being immunosuppressed, that I most probably would not survive COVID if I got it. And I figured I would most probably survive a vaccine. So.
Good judgment.
Yeah, good point. I like that point.
The only question is whether you also need a booster.
I'm getting the booster.
Yeah.
Yeah.
Me 3.
These stories about these people who not been vaccinated, who died from COVID, are frightening. But people still go through it all the time. That's kind of sad about the Washington football team. I think only 60% of them were vaccinated until people started complaining about it.
Yeah, the coach especially.
Because he's chemotherapy, cancer survivor. Yeah.
Oh.
And the commissioner let him know, said if the team cancels a game, they lose all the money. Okay, so they're going to lose millions of dollars for a canceled game due to COVID outbreaks within the teams.
Yeah.
Now, John, is that just with one person coming down with it, or?
No, it means if you don't have enough players to play.
Right.
Because one person wouldn't stop the show. But if you got a number of persons out and you can't play because of the lack of eligible players, then, and it's due to COVID, then you will lose money.
2 weeks ago, the Nationals had 4 players and 8 staff members who were positive. So they had to cancel a game.
So 4 monkeys will stop a show.
Yeah.
That's so politically incorrect.
Well, look, this is interesting. This should help some people who are reluctant, who thought he couldn't get it, who got it, and affected his wife and children.
Oh, by the way, Janice couldn't be on today because she had a leak in her refrigerator and had to call the plumber. And Flavia said that she was out of town and she'll be back with us maybe next week. But I
Oh,
thought of Janice when you said, her son, I guess he thinks he's invincible.
yeah, right, right, right. Yeah. Well, many of the invincibles are coming down with COVID. So
Dr.
Now-
Callender, this is Dolores. And
Okay.
my question is, I took my mother to the emergency room. I took her to a doctor's appointment because she fell and broke her arm and wouldn't go to the emergency room when she did it. So I got her in the doctor's office. He called over. He sent us to the emergency room. Well, another senior came in from urgent care from somewhere else, and they had all her records and stuff with them. And she was sick, but her daughter kept saying, well, she just has fluid on her lungs. And then somebody asked her a question. She said, no, she ain't taking no COVID shot. And I didn't take it either. And everybody looked at her like, are you kidding us?
ah,
So people started moving, and
Oh,
then she got mad because when they finally called her mother and took her mom back, but they didn't take her back there where all of the other patients were. They had her someplace else, but they wouldn't. She said, well, how come I can't come back? That's my mother. And she has dementia sometimes and all of this other stuff. And they were like, lady, it's better if we got your mother in here. It appears that she's got COVID symptoms. So now we got to test her. No, don't test her and don't give her put that stuff in her. I said, oh Lord,
oh,
it was crazy.
yeah, that's
And I
crazy.
couldn't understand it. And
Yeah.
how do you treat a person like that? You can't,
Well,
you
they have
can't,
rights.
I guess.
They have
spray.
rights. They have rights like anybody else. So they have the right not to accept treatment. So what can you do? I know in the hospital, if they don't get COVID testing, they probably will not be treated.
Yeah, when I was admitted, I got the COVID test and then I
Yeah.
had to wait in a special room all by myself for 3 hours looking out the window. It's like, oh, and
Yeah,
then,
that's the rule. So
then they let me up on the floor. So that was good.
yeah. But these are interesting times. Interesting times. Well, this is clear. We've discussed this, and hopefully no lockdown, because the impact upon the finances of the country are so negative that they're not likely to lock down, whether they need to or not. I think the reason why he can say that is because 70% of Americans are vaccinated. If they weren't vaccinated, he would have to lock down.
Dr. Callender, this is Sylvia. Is there any information on costs, like for those who are not insured and have COVID and the extra costs that it's generating for hospitals and creating additional bad debt or anything like that? Any stats on any kind of information
Are
like
you
that?
talking about the hospital or the patient?
The hospital.
Oh yeah, the hospital. Yeah, there are funds available.
Okay. Okay.
Yeah, special COVID funds are available.
Okay. And for the patient too, if they're diagnosed with COVID, is there any reimbursement to them for?
Not that I know of. Certainly for the hospital, I know there is. I don't know about any reimbursement for the patient.
Yeah, so I don't think they're talking a lot about what the additional costs are to patients, Maybe that might be an incentive, maybe.
I don't know any, most of the costs are to the hospital.
Okay.
And I don't know that they have been cons- that has been raised as an issue. So I don't know the answer to that question.
Mhm.
What about schools? What's the latest on schools? There still is a lot of
Well,
discussion.
Georgia schools are, this is Vera. Georgia schools are open, and most of them that was home for last semester, last year, are now back in the classrooms. They all have to wear a mask.
Yeah. What about DC?
DC,
I don't know about these.
DC, they are planning to have people go back to school, kids and teachers, and the teachers and the students have to wear masks. Now, in Montgomery County, I just heard from my daughter-in-law that this fall they're going to give the parents a choice whether that they can send their kids to school or whether they want them to go virtual. So they're giving them a choice in Howard County. They have a choice. DC, they're opening up for school. Rochelle is getting ready to come on the line.
What about churches?
My church had
They're
planned
open.
to open up in September, but now the Delta variant is causing people to change their minds on opening up in September.
Well, I went to a funeral last week, and what was interesting was that they told the people in the audience that they could sing as long as they wore masks. But then when the choir sang, they took off their masks. I thought that was very interesting. Not wise, but very interesting.
Carol, tell us about the new singer's mask that they have out now that costs about $25, specially designed for people who want to sing. Carol, are you on the line?
Yeah, you just told them.
Tell us about them. Tell us more, honey.
You just said it. There's one of my favorite friends who's an opera singer, and even when he's doing opera or singing at musicals or whatever, as things opened up, he's got a singer's mask, and he told me about it. I went online, and there is a singer's mask. And another guy I met who teaches instrumental music at this college, he had an instrumental mask where you can unzip it and where he could play his instrument, and then when he's through playing his instrument, he zips it or flaps it back. So they have two types of masks, one for singers, and it's there so you can sing and breathe correctly, and the moisture that goes out, it will be in. And so it's called a singer's mask. It costs a little bit more, and the instrumental music people that are playing instruments, especially wind instruments, they have a mask particular for them. They cost more than regular masks. But I don't think the vocalists or choir members are really, it hasn't been introduced to them. But you're right, Dr. Callender. Vocalists now, even praise teams and everything, they take off their mask, they sing, and then they put them back on as soon as they're through. What's amazing to me, churches are opening up for funerals, but they're slowly opening up for worship service. And I know a lot of churches, they open up, they letting the congregation come for funerals, but for their regular worship service on Sundays, they're not opening up. But a lot of churches are opening in this vicinity in September, or they're trying to anyway.
So they're worshiping the dead instead of worshiping the Lord.
No, that's not true. They're worshiping the Lord when the people are dead. That's not
Okay.
worshiping the dead.
Whatever you say, clean it up for me.
I think people would take a different way if for some reason, every time we would breathe out, exhale, purple gas would come out. So you can literally see people's exhalations, and people would scatter and move. They would not, be all up on each other and stuff.
That's the
It-
Mickey mask. Huh?
Uh,
But
That's
the other,
interesting thought, though.
but the other thing though is that a lot of this is spread from aerosol, droplets in the air.
mhm.
Yeah, and that's why it bothered me a bit when I saw the choir singing without masks, and because I thought that was prohibited, but well.
And then fans going, blowing it around.
Well, that's a hot flash. You're singing, you get a hot flash, so you just spread it.
You get your fan out and spread your germs.
Any new members today?
We got returning members. Rochelle back after not being here last week, and Dolores is back, and Vera is on from a while back.
And Linda.
From 10 years. Uh-huh.
Well,
It's coming
Yeah.
up. December is my 10-year anniversary for my transfer.
Wonderful. Wonderful. Congratulations.
Yep.
Time flies. Time flies. Yeah.
when
Okay.
we're talking about breath, and if you could have like a purple mist, it got me thinking about, if there's some way to tell if somebody had bad breath, and it is true. Gum and mint sales are down during the pandemic because people aren't as with social distancing. They don't have to protect their bad breath, so those sales.
Thank you, Darryl.
Know that.
One of the first learns when you first put on the mask, at least I did, one needs to brush one's teeth before you put the mask on. And the first time I put it on, I was like, oh, no. Mm-mm.
Yeah.
Oh,
Got to smell your own breath.
yeah. So maybe a lot of the is they may just maybe brush your teeth first or something. I don't know.
Yeah.
Well, the cosmetic industry or makeup industry has lost sales. And I noticed one time I accidentally put on lipstick and had a mask on. So you really don't need to wear lipstick when you got a mask on. So those industries, they should be lacking, but I guess they're still selling. I don't know.
Well, we need a group session and talking about how toxic lipstick generally is. That's some nasty stuff y'all put on.
From the health food store, it's okay. It's beeswax.
But it is, and it is toxic, and I know that. And things that you put on, ladies, what you put on your face and etc. Your skin is healthier without makeup on, or even putting the eyelash stuff and covering up my eyebrow. But anyway, that is toxic, or you use it one time and then get something new, then it's too expensive. But putting lipstick on is definitely toxic to you because it's going into the pores of your skin. And I shouldn't put on lipstick, but I want to look younger. I don't have any on now though, but anyway.
Black women are naturally beautiful. We don't crack. Y'all don't need makeup. Y'all stop wearing that and you'll be beautiful anyway.
Thank you.
Thank you,
Thank
Darryl.
you, Darryl. Yeah.
I have a comment. This is Vera. If the women would still use a cleaner and an astringent on their face, their complexion comes out beautifully without the makeup.
Right.
If you should clean your skin before you go out and put on, tint or something on your face without makeup, it really improves your features and your own good looks.
Thank you for that. I needed that.
Okay.
You gonna
So
try
since I've been brainwashed, after I retired, I finally stopped dyeing my hair because I know that was toxic too. But it's a slow process, very slow process, because I've been indoctrinated all these years. black hair and put on a lot of makeup and looking good, fake eyelashes and all that kind of stuff. But I'm slowly evolving, trying to be my natural self like you men on here. They never had that for you men. Y'all don't care. Y'all don't put on nothing and etc. Y'all, you should live longer, but I don't know why as women, we live longer with all this toxic stuff going in.
Because men are poorly
Don't we
managed
women?
online, but y'all women need to stop straightening your hair
Yeah.
too and putting on them permanents. Those permanents are just as toxic as they can be. Y'all go natural, please. I need
Yeah.
to see everybody natural next group session.
That's a
Darryl,
long.
go. I'll talk to you later. I'm okay, whatever. I still brainwashed.
And by the way, next week, I think we're going to have a discussion on depression by one of the psychiatrists. So
Okay.
see you all next week. Have a nice weekend.
Okay, thank you, Dr. Callender.
Yeah.
I hope I'm not